Hello. I think we're live. I don't know. Hold on. Sure, but I don't know if we're live. Hold on. Oh, great. We are live, I think. Hi. I think. No? Yes? No? I can't tell. Yeah, you never know sometimes. The morning starts out great and then it has issues, so
yes, it does.
We're checking. Hi, come on
Hello.
in. Ah, everyone's all Christmassy.
Yes! Except for me, I just have the pink shirt.
Are we live? Having trouble playing this video. Yeah, no, I don't think we're live.
Aww.
I know.
We're not live?
I don't think so.
Well, I have to go. I have very short breaks.
I know, dear. So. Oh, okay. So yes,
Hi!
we're live. Say hi, Gavin. Say Merry Christmas.
Merry Christmas, everybody!
Well, Happy Holidays, because I
Happy
think
holidays.
it's Hanukkah started
Yes.
2
Sorry.
days ago. Is that
Pardon
right?
me. Happy holidays.
Happy holidays, everyone. We're so sorry. We're starting about 6 minutes late. Madison's outfit of the day is...
I'm supposed to be an elf for like school.
Ah, there you go. And Mama is well, thank God. And well, someone gave me this for my birthday,
really
which is just a
pretty.
few days ago. I know, I love it. And I'm psyched because it's perfect because I'm sweating now because I was stressing over the connection. So this is nice and fresh and and pretty and stuff. Oh, I'm worried about Facebook. I don't know if we're streaming live on Facebook yet, but I'm gonna trust that it'll happen and it's working and people are telling me we're okay. So I'm gonna trust that we're okay.
Yep.
Let us know if you can see and hear us. Give us a ho 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 in the comments. Okay, so yay! Welcome everybody.
Welcome.
And to our to our Skinsights live on sensitive skin.
Ooh.
And it seems like something we've already covered because we've covered so many skin conditions from psoriasis and eczema, etc., etc. But this is interesting because it's sensitive skin that is self-reported. So people who don't necessarily have a diagnosis of contact dermatitis or atopic dermatitis, and the skin doesn't present the way certain skin conditions do, but people still feel burning and stinging. So it's actually really, really interesting. It's not really talked about all that much. So when her grandmother, my mom, brought it up, she said, you know, there's some new studies on it. We should talk about it because sensitive skin is a thing. Before we get started, if you're watching on YouTube, don't forget to subscribe and hit the notification button. And on Facebook, remember to follow us.
Yeah.
On both places, please remember to comment and ask questions early on. The earlier we get those questions in, the more I can make sure that we get them answered.
Yeah.
Most importantly today, we are giving away...
Ooh, what's that?
Here, help me. It's a travel-sized Re-Everything eye serum. That's a little banged up because it's an old tester that I got and use at home.
Oh, that's so cool.
But it's awesome. It's one of our best-selling products, and it's a nice little luxe thing. It's got glycolic acid, kynotin, our organic virgin coconut oil, lots of antioxidants, and a hexapeptide that does like a little
lift. It's an
yeah,
eye
like
lift.
a little temporary banat, like a little pull, which is really nice. It's temporary, but it's super nice. So make sure you like us, follow us on Facebook, subscribe on YouTube, and in both places, ask us a question or comment so that you qualify, and we'll announce winners at the end of the day for that.
Oh, cool. So you just have to comment.
You do, or ask a question.
Cool.
So getting into our topic for today, sensitive skin is something, honestly, like I used to roll my eyes about because I'd be like, sensitive skin, everyone has sensitive skin. And I'd be like, but what is the diagnosis? Is it atopic derm? Is it psoriasis? It's so vague. It's a very vague designation, and we're so much more used to dealing with diagnosed skin conditions that you can really diagnose either from scrapings or biopsies or clinically. So yeah, sensitive skin is kind of something I was like, whatever. You know, someone says they have sensitive skin and don't have a real diagnosis. I was like, what is that really? Maybe it's just psychosomatic. Well, like many times, I, was wrong.
I didn't even know this was a thing.
I know, that's why. So research into sensitive skin has continued, and this is what we've learned. This is actually fresh off, not quite hot off the presses, but really rather new. The sensations reported are usually burning or stinging. This type of sensitive skin is subjective because there aren't always the typical signs of irritation that we would expect to see. And it's largely self-declared. So in worldwide studies, we're looking now at 60 to 70% of women who self-declare as having sensitive skin and about 50 to 60% of men. It's also variable. I think that's what makes it difficult. No? People who experience stinging with one ingredient may not with another that has a very similar mode of action, and may experience the sensation on one part of the body but not another. And some who say they have sensitive skin do not experience irritant reactions, while some who do not consider themselves having sensitive skin respond strongly to tests of objective irritation or allergenicity. So it's subjective, it's a little vague, and it's a little inconsistent. And it relies primarily on self-declaration of the patient. But thankfully, over the years, I think medicine has become better about not being dismissive about such things. Because you can experience these things, even though there isn't yet, and I think emphasis on the yet, an objective way to determine it. The thing is, too, it can sometimes mask another concern or a confusion with another condition like seborrheic dermatitis or rosacea, which can also produce stinging sensation. So it's really, really important if you think you have sensitive skin, not to, suffer through it. Go talk to a dermatologist.
Please don't.
Exactly. In terms of products, again, safer is better. Essence, Clark Wash, and conditioner. These are the travel sizes, but they come in larger sizes. I'm showing these off also to show that so much of our skincare comes in travel sizes, which is great for stocking stuffers. So this is the Clark Wash and conditioner, which are great options for hair and body cleansing if you have sensitive skin. Because we're talking about stinging and burning, which are things that also rosacea experiences, Red Better, the Daily Soothing Cleanser, and the Daily Moisturizer are great ideas because they're extremely gentle, but they also have anti-inflammatories, anti-cathelicidins, which means too, for daily moisturizing.
Boo Boo Balm?
No.
Oh no, wrong.
Yeah.
Oils Well, sorry.
Oils Well or No It Oil, which are
Yeah.
our organic, clinically published virgin coconut oil, anti-inflammatory, barrier repair, and if the stinging and burning are occurring at the moment, Boo Boo Balm or
And
Red Better Calm the Heck Down
Calm
Balm
the heck down. Yes.
are great options.
These two.
And certainly our Skintelligent beauty products are a great
yeah.
idea, just to stay on the safe side. This is a really pretty blush. This is what? This is Georgia,
oh,
which I think looks really excellent too on very dark skin tones. There's also dye-free options. Bellini is my favorite in that regard. But there's also our mascara and our lip gloss. Don't you love how I'm not showing that well? It's not helpful at all.
Here. So these
there you
are
go.
our two.
Yeah.
And then this one is, I think this is.
That's a lip gloss.
Yeah, but what?
What shade?
Yeah.
It's on the bottom.
Princess. Okay.
Yeah. So, that's sort of what sensitive skin is. We'll get into it a lot more when my mom, who's just over there and coming in soon. You can get all of this stuff and your stocking stuffers. I mean, look how cute to put in a stocking.
Aw.
Like it does everything.
It's so
right?
tiny.
It's
but
so
they look
awesome.
So
You can use it
good.
for bullet coffee and your salad and everything. That's a No It Oil. Any of our moisturizers are a great option for the holidays. Our concealer, if you give a concealer in something like green red alert, it's great for camouflaging. Even Boo Boo Balm comes in a mini. So point being, nice stocking stuffers.
Everything.
Okay, so you can shop all these products at VMV Hypoallergenics.com internationally and VMV Hypoallergenics.ph in the Philippines. in the USA, remember to get your orders in early for a better chance for holiday gifting. And in the Philippines, we're also giving out our cool VM Verdant bag, which is awesome for shopping safely when you're going out, because then you come home and you throw this in the shower when you go in the shower. And there's no plastic, which is awesome, and it rolls up and is really cute and everything. We also want to remind anyone, it's been sort of going around the house, so people have been feeling sick. The monolaurin pellets are a great option, so DM us if you're interested in that. Or if you'd like a teleconsultation with my mom or another doctor that we work with or nutritionist. And remember, from anywhere, you can send us your allergens from your patch test results, and we can customize recommendations for you based on those allergens and potential cross-reactants. Would you get your grandmother for me?
Of course. Anyway, I have to go soon.
All right. See ya, honey. Thank you for helping
Sorry.
me.
Bye-bye.
And she, so yeah, without further delay, I will call in my mom, who's our founding dermatopathologist, to help us understand sensitive skin, plus to answer some of your complicated skin questions. So again, please get those questions in or comment, and make sure to like and subscribe so that you can qualify. We'll announce winners at the end for Everything Eye Serum. So, there, hi, come on in.
Hi,
So,
hi.
hello,
Let me just put this here properly so I don't cause any accidents.
Hello.
Mwah.
Have a seat.
Yes.
I put this here for you to
Oh,
sit
great.
on.
That's perfect.
Okay.
Gracias.
So it's a relatively new topic, or at least the studies are still developing about sensitive skin. Just
May I
sensitive
just go
skin.
get my glasses?
Sure. So just sensitive skin. So it's really wonderful to have her, Dr. Vermen Verallo-Rowell, as our resource expert, because she has access to all these great new studies. The reason this happened is because a new study came out and she started talking about it with me. So she's a multi-published, awarded clinician and researcher and expert at objective diagnoses through a microscope, like from a biopsy. That's what dermatopathologists do, and at sensitive skin conditions. So it'll be great to get her perspective on sensitive skin. So
Yeah.
say hi to everybody.
Hello, everybody.
So yeah, so get your questions in early for sensitive skin in particular, so that we have time to answer them.
It's a totally different subject matter compared to the other things we've been discussing in the past several live streams. This is called SSS, Sensitive Skin Syndrome. And it's fascinating because it's not contact dermatitis, it's not allergy, it's not photoallergy, it's not irritant or contact dermatitis. It is a well-recognized sensitivity of the skin, but how it is characterized is that it is a transient. Transient meaning it
Transient meaning it
transient
comes-
meaning it will come
and go.
and it may last a couple of minutes, couple of hours, maybe a little bit longer, and then it disappears. All right, and what you feel is a bit of numbness, though tingling is a very common tingling.
I read burning and stinging.
Burning, stinging, tingling, tautness of the skin, and even in more severe cases, there may be actually pain and itching, but transient. And there are a lot. I went on.
Transient and not necessarily because of something that's a known irritant.
That's right.
Okay.
Or actually initiated by a known irritant, because an irritant can produce a reaction that irritates and will last for a longer period of time. But in this one, that same irritant may actually initiate it, like in certain chemicals from cosmetics, for instance, or skincare. But then it just is a stinging, tingling, funny kind of a sensation that lasts for a couple of minutes, couple of hours,
So let me ask you the hard question first. Is this legit? Because here's the thing, like I mentioned, right? There's a lot of skin conditions that are objectively sensitive, and there are objective measures. There's patch tests to see what they're reacting to. There are ways to see visible irritant reactions to something. And because, especially with both allergic reactions and irritant reactions, I wonder if we should do a live about this too. If your cells have learned to become allergic to something, as long as you come into contact with that thing, you will get a reaction, right? No matter the concentration, sort of. if it's an irritant reaction, you're not necessarily allergic to it. So you can actually use it quite regularly until a certain point, right? So if you're using or exposed to an irritant and you keep using it over time, eventually you'll get a reaction. But these things are fairly repeatable.
Right.
Right.
And they can actually be tested. Like
Yeah.
in an allergic reaction, the T cells, they behave correctly. You know, you put it on the skin in what we call a patch test, and within 48 hours, those T cells inside that skin, in the dermis of the skin, will begin to react and produce a reaction in the area where you put the allergen. That's a positive test. That's for a positive to an allergen that you're to a chemical you're allergic to. Irritant, contact dermatitis, actually can give you similar reaction, but the difference is that there are certain ways we know whether it's an irritant or an allergic kind of a patch test, and it's repeatable.
Right. But with,
With
sensitive,
sensitive skin,
it's not.
It's not.
So
It's
how do
not.
we even know it's legit?
Because it actually occurs. I've had patients with sensitive skin, and it's amazing.
That sounds
Their patch-
awful, but-
the patch test is negative, but they really have, and the reasons for it are becoming clearer and clearer nowadays in the days of molecules and genomics. Okay, you think in terms of two parts of the skin, and that would be the nerve endings, okay, and what the cells themselves produce as a reaction to the trigger. Okay, let's start with the nerve endings. One of the reasons they say there is such a thing as SSS, sensitive skin syndrome,
Word of the day,
is
people.
barrier. Again, we come back to the barrier. The barrier has been thinned out because of certain diseases, so that therefore those nerves, because the barrier is deficient, the nerves that the very most superficial nerves down there in the dermis are actually more exposed, and so therefore they react to certain triggers like heat and
So-
sweating and temperature changes, things like that.
So would it be safe to say, and maybe this is an ignorant comment, this is very new to me, guys, because again, I'm more used to where's the test result, right? Would it be safe to say that sensitive skin syndrome has more to do with nerves
Yes.
than with what? With contact?
They have something to do with nerves. It's an aberrant reaction of the nerve of the skin. That's really a nerve thing.
Okay.
The other part that I'm getting to read about
Fascinating.
is what the trigger comes, then how the epidermal cells themselves react. So we're talking about, this is the skin, and we're saying it's really some aberrant reaction of that nerve there. Number one, because of barrier deficiency. Number two, because you have the genes for the reaction of the expression by those keratin cells of certain chemicals that stimulate the neuropathy or the reaction of the
But
nerves.
at the end of the day, it's a nerve thing.
It's a nerve thing.
There you go.
That's why you have stinging and burning and
Interesting. Okay.
It's really interesting until you get. I never thought I believed in it either for a long time until a patient came, and boy, I tell you, tested her, negatives, but she would sting and burn and itch and whatever. That's sensitive skin.
Okay, so I still want to push this because I believe it's okay. I still want to push this because she has patients who have real nerve issues, right? Something that more people might be more familiar with would be herpes zoster, shingles. Extremely painful. I had this when I was 10. By the way, if you get shingles, herpes zoster when you're older, definitely you need management by a doctor because there are other things that are potential risk factors. So you should talk to a doctor. But with shingles, the nerves are really in play in a way that I don't associate when I get like an itchy or painful reaction, like when I was with Gavin and I had that allergic reaction to the binder.
Because it's not the superficial cutaneous nerves that are affected.
So the nerves are really in play. So I get that and how different it is, right? But if there's no test, and if it's largely self-diagnosed, and if it's so vague. I was explaining earlier that you can have the sensation here but not here, right? So it can even be, you mentioned transient, it comes and goes. So if I take the same material and I do this today, it might hurt, but tomorrow it won't.
As a matter of fact,
Then what? How?
the face
Yeah.
is the most common area, but there are other areas that are affected by this, including private areas, the anogenital and the perianal, genital, inguinal area, as well as other parts of the body. This particular
So, but
patient,
how do you know? How then can you diagnose it? Like if you, we sometimes have
it's
dermatologists
consistent,
to watch.
it's recurrent, transient, but it recurs in those places with particular triggers. As a matter of fact, one of the
But it's
tests,
not consistent. It's transient, so it comes and goes. And then let's say today.
but it comes in the same place all the time.
Okay. I'm struggling. I'm really
It
struggling.
exists. Please, anybody out there who has what you feel might be a sensitive skin syndrome like this, where you sting, you burn, you feel irritable in certain areas of the body, face, whatever, but consistently there and consistently in reaction to certain triggers. Please text us. Please write. Let me know.
Fascinating stuff. It's really
if you feel
rather
you have
new,
something like
the understanding of this. Wait, I have a wonderful question from Josephine on Facebook. This is really good, so I want to spend some time here and sort of break it down. My sister-in-law always says she's allergic to everything, when sometimes what she means is she's sensitive to it. What causes sensitivity? Is there a difference between sensitivity, irritation, and allergic
Oh, nice.
reactions in terms of symptoms? And could someone build up resistance to irritation triggering ingredients when not from allergies? Okay, so let's break that down one by one, right? What causes sensitivity? So she discussed a little bit, if I heard you correctly, the barrier, there has to be, it seems like there's a barrier dysfunction.
We're talking about SSS.
Yes.
Okay.
What causes, well, her first question is, what causes sensitivity? Like real sensitive skin syndrome. Okay, let's start with that. The barrier layer of the skin seems to be involved and seems to have a dysfunction such that the nerves are aberrant.
The
They're
superficial
not,
cutaneous nerves. Way
yeah.
out.
They're maybe hyperreactive, or they're not well. They're not entirely well. That seems to be what sensitive skin syndrome is. What causes that, you know?
Can
This is
be
Josephine's first question.
atopic dermatitis, actually. It could be due to the absence of certain proteins called integrins, you know. Thought I'd...
Integrins, folks. Yet another word.
Right.
This is very new, like I said. So this is sort of, we're all kind of stumbling through
Right.
this.
They're the proteins that attach the epidermal cell to the basement membrane, for instance. And if that is a little bit faulty or whatever due to a genetic or a molecular kind of change, then you can have a sensitive skin as well from that.
Okay. So it could be genetic.
Could
Could
be
be
genetic.
exposomes caused. So food, diet,
Yes.
sleep,
Right.
etc., stressors that you're applying on the skin. But the nerves seem to be involved because the barrier is
But it's
dysfunctional.
primarily that. The nerve and the epidermal cells seem to be actually involved. So more of the studies that have been coming out have been talking about the various genes that are expressed, the genes that are stimulated and by whatever the irritant effect, the sensitivity is from. Was that clear?
Yes.
So nerve and the cutaneous nerve and the epidermal cells. So those are the things that we need to be looking at. And apparently it may have a molecular genetic basis, and it can also be due to the barrier dysfunction, which exists nowadays in many people due to one thing or another. So we're expecting more people with sensitive skin to come out. Now, the difference between sensitive skin and your next question was,
Is there a difference between sensitivity, irritation, and allergic reaction
Yes.
in terms of symptoms?
Yes.
Yes, there is.
right?
That I'm
Again, we're talking about who is taking, who's the master here? Who's doing it? Well, in an allergy, the T cells, those are lymphocytes. They're a kind of lymphocyte in your body,
Like in
And-
food allergies, it would be B cells.
Yes.
So for skin allergies, T cells
T
are
cells.
involved.
The T cells are involved. They recognize a certain chemical to be an allergen. In other words, they recognize that when it gets into their skin, it's foreign to them. They will react to
They
that.
don't like
They
it.
will produce a contact allergy to it.
Right.
Okay.
And usually that can be everything from redness, rashes, it can be itching. It can even be like we were talking about in the last live stream. My sister, her eyes start to shut, get very swollen. You can get anaphylaxis, yeah?
Right.
Okay, so that's a real allergic reaction.
Whereas
Irritant
an
reaction.
irritant reaction is not T cell mediated, but it's still mediated by lymphocytes. So mostly B cells, they produce an immediate reaction. And
I realize, people, this is confusing. Really and truly. We're in the business. I really struggle to understand this, so I get it. But so an irritant reaction
is not T cell,
is
it's not
not
constant.
T-cell mediated.
And it depends. So for instance, with an allergen, you can be exposed to a small amount of that material and react and itch. Whereas to an irritant reaction, it's really at a certain level of that chemical on your skin that the B cell reaction, certain kind of cells, and I don't like it, and will get a reaction.
B cells, though, are also involved in food allergies, which are real allergies.
Right.
So why is it B cells also involved in irritant reactions?
I don't know, but they just said,
Okay,
I'm
so
the
B
one in charge.
All right, so B cells are what's involved, the master of the reaction in food allergies, dust mites, things like that, and also irritant reactions. But irritant reactions are not allergies,
No.
right? So you can use something that's an irritant. To me, my favorite example of this is any material. Like if you take, this is probably bleached, honestly, but if you were to take a real organic canvas, right? Unbleached, uncolored, non-stretchy, it would not be a quote allergen, right? But if I were to rub it on my skin incessantly for hours and hours and hours, eventually I'm probably going to give myself an abrasion, redness, pain, right? That's more like an irritant reaction. There needs to be a constant, almost overexposure, or you're pushing it to the limit for your skin. Everyone's different, no? For there to be an allergic reaction. Whereas if I were actually allergic, say, to the red color here, then enough contact with that, I'd probably get a reaction. My daughter was allergic to red dye for a while, and wearing pink dresses was an issue. Okay, so that's sort of the difference between allergic and irritant. For sensitivity, you don't necessarily see the redness, right? But you do feel...
Yeah. There are some people who actually have become a little bit reddish. But again, unlike the reddening from an irritant or an allergic reaction, that once it sets, once it is there, it lasts longer. With the tingling, the burning of sensitive skin, there may be a transient redness of the skin, but it's not lasting.
So my understanding of this is
Go see a dermatologist.
SSS is really more nerve involved, and just trying to
Right.
think back on my own.
That's right.
And this is anecdotal, granted. This is my own personal experience. I have an allergy to nickel. If I wear now, and it's a late, I never had. That's actually not true. I had an allergy to nickel when I was younger. I then lost it, and then it came back when I was older. So if I wear like a cheap watch or something with a backing of nickel, where the nickel isn't bonded well, I'll get redness and scaling fairly quickly, right? For irritant reaction, I gave that example of this rubbing. Like there are many things that are irritants that aren't allergens, but if you're exposed to them enough, it'll be an issue. And I'll get redness, itching, abrasions. But if you've ever had herpes zoster, it is a different pain. When the nerves are involved, like a burn even, right? It's a different kind of sensation. So I hope that answers your question, Josephine. She has one last one. Will someone be able to build up resistance to irritation, triggering ingredients when not from allergies? And I mean, yeah, because...
Resistance not so much as repair.
Right.
So
you stop using it, you'll be okay. Like
Right.
eventually the reaction will go
repair
away.
in the sense that
Yeah.
you may be treating a condition that's making your skin barrier thin. Like you've been cleansing your skin so much That's a good example. Cleansing yourself
That's
so
right.
often and so much with
Water
soaps
can be
because-
irritating. Too much water exposed to your skin can be
That's
an
true.
irritant, right?
That's
but what
true.
she's saying is you stop using it or lessen it, your skin heals.
Right.
And then you can continue to wash again. And then once you get to too much, then it'll react again, right? But then it'll heal. With an allergic reaction, that's not the case. It doesn't matter how much of it. Okay, everyone's asking the same thing I'm asking, which is, so Jenna on Facebook, hello again, is how is it determined then, SSS, versus, so how is it determined to be due to sensitive skin and not a neuropathy?
That's a good question.
Lovely question.
That's a very good
Y'all
question.
are so smart.
Because
Love
I
it.
really looked at the most recent systematic reviews, meta-analysis of many studies on this, and although it mentions the nerve as an important part, an aberrant reaction is what they call it of the nerve. This final one the most recent one that I read said, you can't really show that it's a real neuropathy. The neuropathy apparently has a definition that is distinct. It exists, it lasts. This is the way I understand it. Whereas this is transient aberration of a reaction of the cutaneous nerves of the very superficial part
It is
of
a
the dermis.
transient,
Transient.
aberrant reaction
of
of
the
the
cutaneous
nerve,
nerves,
of the cutaneous level of the skin.
as opposed to a neuropathy,
A neuropathy is
like from
what?
diabetic neuropathy. Oh, there's a good
Okay,
example.
so what is diabetic neuropathy?
Diabetic neuropathy is in a person who has diabetes that's so often uncontrolled, or maybe controlled but not quite well enough. The nerves become inflamed. There's a certain degree of inflammation that occurs because of because diabetes, as you know, is an inflammation. And so, therefore, it becomes neuropathic. It develops
And it's more constant.
yeah, it's more constant.
It's a more constant pain. So we have actually a very dear friend of ours who is the pediatrician of my children. He was my pediatrician. He was
There
the
you go.
pediatrician of my sister. He's just the pediatrician
And now
of
as adults,
everybody.
they still go to him.
Oh my God! I won't go anywhere else. He can diagnose on the phone. He'll be like, "Have your son cough into the phone." He's this old Spanish dude, and he'll go, "That's croup. It's okay." 50 years of clinical experience. Anyway, he now has a constant neuropathy that's extremely painful day in, day out, and he was using steroids for so long, and it became so bad that when he developed a really bad infection that they had to operate on or something, they couldn't even operate on him because they had to clean his system of all the steroids first to figure out what was really going on. What was it they really had to treat versus anything else caused by the steroids? So we'll get in, and we have a live stream about steroids separately, no? But what he has is a constant, which he's saying, the neuropathy is the constant pain, discomfort, right, of the nerves.
Due to a more persistent nerve problem.
Right. So she prescribes to him a neurontin preparation that really acts on those nerves. When we're talking about sensitive skin syndrome, it comes and it goes. It's not something you wake up with in the morning and is with you all day and day in and day out, and you go to sleep and you have problems sleeping. It really is in reaction to something, right?
Neuropathy is persistent.
Right, neuropathy is
Very good.
persistent. Y'all, I'm sweating with you, okay? So I hope that answers Jana, because
I
think
would
it's a
like
great
to
question.
talk a little bit more in case there are doctors who are listening. This thing about using gabapentin topically on the skin is we actually, together with Dr. Monet Aquino of the Philippine Dermatological Society, we had this article actually presented as a poster and a paper in the Academy of Dermatology meeting in the U.S. And then it got published. We submitted it for publication, and it was published in the January issue of the International Journal of Dermatology. The use of gabapentin in a cream formulation for neuropathy, different from SSS. Okay?
Gabapentin is a topically applied nerve quieter, for lack of a better,
Not for an aberrant.
Right. It's like a nerve whisperer. So it's great. Okay. Now, Anne is
like that.
asking on YouTube, how would you know if you have sensitive skin syndrome versus maybe just a reaction to a certain ingredient?
You probably have, if you have a reaction to a certain ingredient, then you would be patch test positive. You mean a contact dermatitis reaction. If you're reacting to that certain ingredient as just an aberrant reaction of those cutaneous nerves, because in that particular part of your skin, the nerve happens to be under a very thin barrier layer, then you have sensitive skin. And your patch test to that will not be positive.
I'm going to wager something else, okay? So from what I understand, right, if we're going to say sensitive skin syndrome is really more of a nerve thing, but it is not a neuropathy because it's not something that you wake up with every day, it lasts all day, it's constant. So when you apply something, you experience something that is really more nerve related, numbness, tingling, burning, stinging, as opposed to the typical stuff for a reaction for ingredient. You'd have scaling, right? More redness, itching maybe. What she was saying earlier,
It's an
sensitive
evolving reaction of the
and
skin.
yeah.
Yeah.
Versus seems
This
to
is
be
not
very
evolving.
specific.
It just tingles, it just burns.
And then it goes. That's one way to kind of guess at it. My suggestion here, if this happens enough, either the redness, the scaling, the itching, the urticaria, which is the raised bumps, or feeling like something's burning or tingling or numbness or itching, see a doctor. Because as you can see from this discussion, these studies are rather new, they're still evolving, and it's hard to understand, I think, even for some physicians. So it really is not something that I would suggest any layperson
I can suggest
figure
this.
out.
In addition, Lau, I can suggest this. Be your own observer. And you can bring your historical novel about yourself to the doctor when you go see them. What I would suggest is that you actually do a calendar. You know, I woke up in the morning and I was perfectly okay, and then you write down at 10 o'clock, all of a sudden I felt a stinging, burning, and locate it and what part of it. And it
Specifically
seemed
where?
to me the trigger might have been this. And write it down, and over time you can begin to probably look at,
Yeah.
you know.
Actually, if I can share this about your particular ovarian experience.
Yes.
Okay, so she did this with my father, her late husband, who had multiple myeloma, and then my sister did it with her for her ovarian cancer. So here's the thing about cancer that I think we're straying a little bit, but it'll come back to this topic. The thing about cancer, I think, that sometimes happens with some families is it's such an overwhelming diagnosis and experience for the whole family because we're dealing with a whole bunch of emotions and fears and whatever, right? What we have found helpful as a family, and I know her doctors have always loved, is that we make a grid on like a Google sheet, and all of her blood results, all of her PET scans, they're all there by date. This was the result, etc., etc. And with her husband, with my father back in the day with multiple myeloma, we would also write down things about his reactions to certain drugs. So we knew he was getting mouth sores, and he would get them after the stem cell transplant or a particular chemotherapy. If you are very good about making a grid on this date, or you can have, there are calendar apps, there are diary apps that you can use, and then export them into a Google sheet, right? The nice thing is when you look at it like that, or even in a chart, or when your doctor sees it laid out like that,
It's
it
amazing.
can really help identify.
It helps focus.
Okay, that's what we have to look at now. This, of course, in addition to patch test, a biopsy perhaps, or a scraping, right? If the patch test is negative, if everything else is negative, but you're still experiencing these stinging sensations, having a diary that's really specific about when they occurred, what the sensation was, where it was, and what you were handling or came into contact with can go a long way towards helping identify what the triggers might be. So there. Okay. Going to MY on YouTube. I'm allergic to dust. How can I protect myself in other people's homes, which trigger my allergies? Oy.
Okay,
Like my sister.
When you say you're allergic to dust, that is, to me, I would immediately ask you about many other questions. Excuse me.
Bless you.
Sorry.
Here.
I'm sorry.
Bless you.
Thank you. I'm supposed to do that, right? So, because what is in dust? Many things. In dust, you can have dust mites. I was explaining to a patient yesterday, you know, you've been getting itching from the clothes that you're wearing. What are they? I said, well, this is the one that I got from I said, when was the last time you wore it? Well, I wore it, I haven't worn it for almost a year, but I got it, put it on, and I itched. That can be from dust mites, because you may have a clean home, but the dust settles and stays in cupboards which are not opened, or, you know, and he didn't shake his shirt or whatever. So you can have dust mites there. You can have certain chemicals that become part of it, like, for instance, so many of the chemicals, you've heard me say about this, there's so many chemicals nowadays that are being used to disinfect homes are actually airborne chemicals. They get up into the air, they become part of our environment, including those mosquito repellents and room fresheners and things like that. They become part of that. So they can go into the dust as well, and therefore be part of the dust. So they can be actually allergenic
Right. So
materials.
is it because dust mite allergy is quite specific to the feces of the dust? Is that right?
Yes.
Right. So first, make sure the diagnosis is correct. It's actually a dust mite allergy, and that's a prick test. And it's not a contact, or it's not also a contact dermatitis to stuff in the dust, I think is what she's saying.
Right.
But the question that she has is, how do I protect myself if I'm in other people's homes?
Oh, if you're in other people's home, you tell them ahead of time that you're allergic to
dust.
Well,
How does my sister do it? I'm trying to think.
what do
Okay,
you
so what
mean?
my sister does...
Let me clarify the question. You are invited to somebody's home, or you are going to live in somebody's home?
When I go to other people's houses, which trigger
Well,
my allergies.
Well, I don't think a dust allergy.
So I can share what my
occur that
sister does.
quickly.
No. So what my sister does, it won't occur so quickly that if you're just going and having coffee and you leave, it's
Right.
fine. But like what my sister does when she knows she has to sleep somewhere else, and even if it's a clean house, this is not about being unclean. This is having an allergy to a very particular thing that can be common and unthought of in many houses, right?
Yeah.
My sister will bring her own pillowcase. Sometimes will bring her own pillow. Sometimes will bring her own top sheet for the bed. But she knows what her triggers are, and so she'll bring certain things that sometimes she'll bring a little like humidifier, but she also has nasobronchial allergies, and that helps circulate the air in the room. But she'll come armed. Like if someone invites her to sleep in her house, or she's staying in a hotel. First, many hotels, this is a great tip, you can actually ask for a hypoallergenic room.
Really?
Yeah, and they will make sure, you can request, please don't clean my room with fragrance. I have dust mite allergies, and they'll do like an extra special cleaning for you. And you can bring your own stuff. There are many lightweight things now that you can launder yourself, clean yourself, that you can take with you. That might be helpful. And if you need like a barrier to skin, she always talks about having a thicker titanium dioxide, zinc oxide paste. Someone asked last week, what about chlorine and swimming? And then she mentioned wear rash guard, wear hair, oh my God.
Hood.
Yeah, what am I saying? Cap, swimming cap there. And then put the thick zinc oxide and titanium dioxide paste, because it's a physical barrier, right? That might be able to help as well. Okay.
Works. I'm
yes.
allergic to chlorine. The only thing that itches and burns with me is my eyes.
So Therese on YouTube is asking, my line of work requires me to do field work, but despite being fully covered, plant trichomes tend to make their way to my skin, causing rashes.
That's right. You're really very sensitive, therefore, to the terpenes.
So terpenes, I was going to say.
Terpenes in these plants. They're usually from flowering and fruiting plants.
Yeah. Sorry, I just want to underscore the importance of a patch test here. This is one of those classic things that I think if you get a patch test, you can really learn what potential cross-reactants are. She has a very good friend who's also a phenomenal dermatologist from the NIH, Tita Gugay Turner, who had a consistent something. And, the patch test was showing it was from a particular thing. I don't want to get into her business publicly, but the point is, it really takes a while to suss out what I might be exposed to that actually is causing that. So she has some people, for example, who are allergic to pesticides and play golf. And they think, well, there's no, I mean, I'm just playing on the turf. I'm not allergic to grass. I'm not, but because there's insecticide used on the grass, it comes into contact near their legs, for example, and or becomes airborne, and it becomes an issue. If you are patch tested positive for terpenes and things like that, there's kind of a lot of stuff, actually.
Yeah. Have a patch test if you're really that sensitive, because then it will be much more specific. You know, you'd be surprised at how many times patients, when I finally get the patch test, and I said, you're not really allergic to the terpenes, you're allergic to this.
Right.
It can
That's
be
what I was
explained
trying to
by,
say.
you know, and it's
Less effectively, but yes.
It's amazing. It opens up the eyes about it.
Right, like it may not be the...
It may not be what you're thinking of.
Yeah.
Very often.
Right.
Very
It
often.
may not be the flower, it might be the leaves, or it might be the sap of something. Can you guys hear? There's a crazy bird that I feel like is mating or fighting.
Yeah. I think there are babies though. Maybe that's why they have.
So I hope you can hear us. But I think a patch test will help you more accurately identify what it is to avoid. That can make now protection much easier.
More specific.
More specific, exactly. Drop us also a DM, because maybe we can help you fine-tune what it is you need to avoid, Therese.
I'd like to talk a little bit, just a little bit about the doctor from the NIH who came home, came back to the Philippines because he said, I can't stand it. My darkening on the skin refuses to go away. Well, she was among the very first patients that I did visible light. You know, the visible light that we're using for computers and mobile phones and iPads. I used the visible light, 400 to 760 nanometers, to photo patch test to the chemicals that are photoallergens, and found out that visible light can produce a photoallergy.
Yeah.
That's fantastic, you know. So
that's why a patch test is really helpful. Sorry, I do want to give Therese some very, very practical things in the meantime that she can do. One is, again, that zinc oxide, titanium dioxide paste can be a barrier. Long sleeve shirts that are white, etc. You also might look at ingredients in the products that you're using that might have fragrance-related things that might be related to terpenes that are not obvious. Like I'm thinking of things like cinnamic alcohol,
benzyl alcohol.
benzyl alcohol. These things are never labeled fragrance or scent, but they're really related. So that's, again, if you have your patch test results, we can help. Matanglawin on, hi, I remember you, on YouTube. Our skin turns reddish, itchy, sometimes peeling when the weather changes from hot to cold to hot, which can happen several times a day. Is it skin sensitivity or allergy, and how can it be managed?
Now that you've heard us talk about it, you let me know. Consider everything that we talked about.
Oh, right, do your diary.
Write it down.
Okay, I have a few.
Because, you know, as an immediate answer to you, it could be one or the other, but we're not sure until you really focus
And
write
it
down.
could also be,
Is it transient?
it could also be a contact dermatitis.
Exactly, or
right?
atopic dermatitis.
Or atopic dermatitis. So some of these things, anything with a barrier dysfunction, atopic dermatitis, psoriasis, these things can be affected by temperature. Rosacea can be very much affected by temperature. And the flaking can happen, and the peeling and the redness, right? So there are several possibilities here. It could be sensitive skin syndrome, sure. It could be a contact allergy. There are many allergens, especially if they're your allergens. When you're in the heat, it can get worse because with the sweat, it brings it out, and then you react more aggressively. On the other hand, when you go in the cold, it can be worse because the skin dries out more.
And the barrier becomes more deficient.
Right. So it could, I mean, the answer is yes. It could be all of those things, and you probably need a patch test and that diary that we were talking about earlier.
And a
can
good
be helpful
analytical mind to
really help you
look through
rule
it.
out, for sure. Isa or Isa on YouTube, I generally have sensitivities. I was diagnosed with atopic dermatitis. Now I have itchy skin with bumps on my inner thighs and groin area, and there's darkening. Very common, we hear this a lot. I always moisturize with virgin coconut oil, use white underwear. What do I do? Patch test.
Yeah, well, bumps nowadays are very common. And if you take a look at your bumps and they are uniform, they're mostly uniform, you know, that dot-like little bumps. I'm beginning to see a lot of what is called Malassezia Incognito. This is a fungus which is a natural inhabitant of our skin. It's usually in the hair follicle. It's used by the sebum. It's used by our body to break down the sebum.
Feeds on oil and sweat.
Yeah, and it breaks down the sebum, so it produces fatty acids and gives the acid mantle, the acidity of our skin that makes it naturally
I didn't know
antimicrobial.
that. That's new.
All right,
Cool.
that's Malassezia. Well, nowadays, with so many chemicals in the air and that what we were talking about, I am beginning to see a lot of Malassezia Incognito. We call it incognito in that the usual Malassezia skin lesions are called tinea versicolor.
Oh
You
my
know,
God.
Those
Okay,
are those
listen.
white little marks.
Okay, there's a lot. I think what she's trying to say, bless her heart, and we'll be here. The reason I'm cutting her off short is at 9:55. We started 5 minutes late, but I want to make sure I don't keep everyone here forever. The bumps can be many, many things, including from Malassezia, which used to be
Incognito.
called Pityrosporum. So it's a fungus that lives naturally in our skins, but can go a little haywire, especially if our legs are rubbing together or it's sweaty. I get sweaty actually in that area. It could also be from Demodex mites, but usually on the face.
That's
no?
usually in the face.
Usually on the face. It could be from
Or in
friction.
steroid-treated areas.
It could be steroid. It could be an irritation from friction, and as long as there's that kind of inflammation, the risk of darkening is there. Post-inflammatory hyperpigmentation. So when I said earlier, a patch test might be a good idea. It might be a good idea. And white underwear is already a great step forward. But remember, underwear also has stretchy things that are allergens. The garters could be causing the problem. The stretchiness in the fabric. There's well, I can't mention a company when she's here, but I will write it. Someone from VMV, if you're watching, please write the name of the company that does the organic allergen-free underwear in the comments, please. We recommend
Or wear
them a lot.
boxer type. There are some beautiful, sexy boxer-looking panties nowadays.
That are looser. Right, sexiness apparently
beginning
is,
to sound
is
like
something
Janeway
to
with my
consider.
voice.
Okay. All right, Jackie on Facebook. My brother developed a dry, rough patch of skin between the cheeks and the nose bridge. Then he also developed it at the back of his neck, a small portion. Comes and goes, quite concerning.
Comes and goes always in the same area.
Apparently, well, that's the implication I get.
Yeah. Could be from the mask.
That's true.
Could be from the elastic that comes around to hold something that when you bring it down.
It could be so many things. My husband developed a stubborn dryness here that wouldn't go away, and it was from the rubberized handle of his coffee mug.
That's right.
I
remember
have
that.
here a dry, rough patch that won't go away, and it's because my desk, I put it on a rubber mouse pad, and this is where I rest my hand. So it could be anything, and a patch test can go a long way to trying to figure out, and then you identify what is that area coming. She had a great case.
That's what I'm gonna say. A teleconsult from the U.S.
Yeah.
And she had a rash that was there and here. She said it's been recurring.
Not even a rash, it was a small lesion that kept
No,
appearing.
this one was a patch like
yes.
that.
Okay, sorry, different
And
one.
I said, and she says, this has been going on for about 5 years. And I said, show me. I've seen people, nothing. They just give me a cream, nothing happens. I said, show me a picture. Don't, really take a photo so I can take a look at it. And then I sent back to her and said, do you realize the size, the shape of that is exactly the same as your telephone? So she showed me her telephone. It's covered by a red jacket. So I said, you're allergic to the red dye. That's
Okay,
what's
so
there.
see your doctor, get a patch test. And again on YouTube, one of the trendiest skincare things right now is vitamin C. They always say to expect 1, tingling or stinging, and that it's normal, and 2, skin sensitivity, especially to the sun. So,
We're talking about vitamin C topically
yeah,
applied?
serum.
Yeah.
Okay. I have a few things to say.
It's not my favorite. It's the only thing I can say.
I can add. So here's the thing. Vitamin C is extremely unstable. Phenomenal antioxidant, but it is notoriously unstable. To be able to extract it, process it, for enough of it to survive, to make it into a supplement, much less skincare, which is exposed more. Because supplements at least are pills, right? These things are usually liquids in a jar or a bottle,
Exposed to sunlight.
shelf life, you know. There's very little that makes it into the bottle usually. So that's the first thing to share. In fact, there's a helicopter, sorry.
But it may remain acidic, and so therefore it'll give you a stinging and a burning.
Right. So first things first, if you really want to try a topical vitamin C thing, look for a dark bottle and a dropper, something that doesn't have a long shelf life, because it just doesn't survive. So in our family, for example, we eat our vitamin C. We don't even take multivitamins anymore. This is different if you have a particular condition and your doctor says you must take the supplement, then take it. But as a general rule, vitamin C, making it into a supplement or a serum, tough. And in terms of the stinging, yes, there could be acidity there. A lot of active ingredients sting normally, because they're irritants.
So glycolic acid to retinoic acid,
Everything.
to lactic acid.
So I actually just put out a video on two regimens with active treatments that explains why that happens and the steps you can take to reduce the risk of irritation or stinging. And most actives will make you photosensitive. They just do. So you have to use the sunscreen. Last question we can take, and then you can go, from Sarge on Facebook. Have been a hypothyroid patient, twinsies, for quite some time with meds, taken care of. Not sure. Okay, I'm not sure if serums, because of their potency, would work best for my extreme dryness. There.
Yeah. Hypothyroid skin can be very dry, yes. You need a proper care of your skin, because it may not just be from the thyroid. You may in addition have, other inflammatory diseases like atopic dermatitis and all. So you really need to be examined properly for the factors that are contributing to your very, very dry skin, and if it's just due to the thyroid. Because if you're being given thyroid drugs, you should be able to correct that thyroid function.
Yeah.
And therefore, from the hypothyroidism itself, it should be correctable. But if there are other things in addition, then all of those should be as well addressed, whether they are contact or photocontact or...
Adding an oil can help too, virgin coconut oil, because then you add humectant and barrier repair properties, and if there are certain patches, then you can add the petrolatum, which
Vaseline.
then becomes an occlusive that can help. We have another
Perfect.
live on moisturizers that would be good to look at.
Right.
Okay, I will let you go.
Thank you.
Mwah, because I know she has appointments.
I have an
and
appointment
research and
at
stuff.
10. Thank you. Love you all. Take care. Distance. Mask.
All right, so I will quickly go through this and we'll announce our winner today. So Sarge just answering, yeah, you can pair the Creamy Rich Intensive Moisturizer with either of our virgin coconut oils. The way we normally recommend it for atopic skin, for example, which is extremely dry, can be, is we layer, right? So we would do like a moisturizer, either the Creamy Rich or Mommy Coddling or whatever, followed by Noah oil or oil as well, followed by Boo Boo Balm, actually, especially on the driest areas. And then I share somewhere, I think it might be on Instagram, and we have a video on eczema that shares a nice tip that she likes very much, which is at night you can apply the Boo Boo Balm and then wrap it for an overnight occlusion therapy, which is great. I think I got everyone. Okay, I'll do a quick review then, and then we will select our winners today for the Everything Eye Serum. But very quickly, so sensitive skin syndrome is something that you even heard, like we definitely would all poo-poo for years and years. We were like, ugh, what's sensitive skin? You can't prove it. There's no objective test, blah, 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 whatever. But it is a thing, apparently, and there's enough studies now coming out to show it. What seems to be, and I love the questions here because they were really the same questions I had, where if it's transient and it comes and bloody goes, if it, it doesn't show in similar reactions to an irritation or an allergic reaction, then how can you prove it, right? So what I think we've learned today are a few things. If you are experiencing, first, the reaction tends to be more nerve related. So it's more numbness, stinging, burning, as opposed to, although you can get a little bit of redness, as opposed to what you would normally get with an irritant reaction or an allergic reaction, which has a growing spread of redness, itching, flaking. If it is more nerve related, then it might be sensitive skin syndrome. But it's not a neuropathy. I really love this question when it came up. A neuropathy is a consistent nerve-related pain, right? You wake up in the morning, it's there, it lasts forever. This is to something that you come into contact with that causes this itching, this stinging, this numbness, or this tingling, or this burning sensation. In terms of diagnoses, I think it seems like you would start with a process of elimination. Doing the patch test, it comes out negative, right? Maybe even doing a prick test, and there's nothing really there. Then you do the food diary, or the exposure diary, if you will, as you would if you had a more complex condition like a type of cancer, and you would really try to put down the diary. When did I feel this? For how long? Where did it appear? What did I come into contact with that caused it? So there. I won't get into a review of everything that we're offering for the holidays anymore because it is already quite late. And I want to make sure I get you out of here in an hour because we started 6 minutes late today because of technical issues. Thank you for your patience. I think we have one more live stream for the year, and then after that we're going to be doing just highlights of our live streams, and then we will renew again next year, restart again next year, and might just be doing on Facebook this time because it seems easier from a technical perspective. But for the winners today, we have congratulations to Ann Lau on YouTube and Josephine Chow on Facebook. You will be getting a travel-sized Free Everything Eye Serum, which is one of our favorite products and one of our all-time bestsellers. So if you want to shop for stuff for the holidays, for people you love, VMV Hypoallergenics.com or VMV Hypoallergenics.ph. We have tons of tips and articles and videos on YouTube, VMVinskin.com, our Instagram account, and any questions that you have, please write them in the comments anyway in the videos. We do try to check them after, or drop us an email from our website, or drop us a message on Instagram and Facebook and Twitter, and we're pretty good about answering all of the questions that we get. So there. Otherwise, if you want to chat with me, I'm on Instagram at Laura at VMV, Lauraat VMV. I'm not great at DMs, but I'm trying to get better, so just comment anywhere and I'll be happy to chat with you about anything. Otherwise, have a great rest of the week, everybody. Beautiful weekend and prep for the busy holidays. Thank you for joining us. Bye.